Welcome back. Right now we are going to be talking with Dr. Rhonda L. Randall all about this open enrollment period. Over the next months, well, many Americans at least, will have the chance to choose their insurance, to choose their coverage, to be able to make those important decisions. And Dr. Randall's here to walk us through that. Thanks for joining us today. How are you?
Thank you for having me.
So tell us about this open enrollment period.
Yeah, you hit the nail on the head. Really, we're in the time of year when millions of Americans get the opportunity to pick their healthcare coverage for next year. For about 180 million Americans who get their insurance through their employer-sponsored plans, that open enrollment season can differ, but it's generally sometime between September and December, usually runs about 2 to 3 weeks. So the window is really short to get the information and make your decision. For one of the 64 million Americans who will get their insurance through Medicare, that open enrollment period begins coming up soon on October 15th, and it's going to end on December the 7th.
And what tips do you have for people making those decisions that can have consequences that we may not even be aware of?
Yeah, my first and best tip is really to understand what all your benefit choices are, to see if they're still going to meet your individual and family's needs for 2023. Their plans may have changed that are available to you, and your personal situation may have changed from what you chose a year ago. So the first thing that I tell everyone is take the time to get educated. You don't want this to be a last-minute decision, and in most cases, if you don't make a change, you're just going to roll over what you had last year. And if you're happy with that, that's fine, but you want to make sure that you have good education on what your choices are. The next thing is, within those benefits, I'm going to go through a list of a couple things that I think are important. The first one is prescription drug benefits. This is the most commonly used service in healthcare, so prescription drug benefits are generally something people go to and look at when they're looking at their coverage options. The next is mental health coverage. We really have learned at the forefront over the last couple of years how important behavioral health is. So make sure you're considering that when you're looking at your coverage, even if you don't need it now. It's something that you want to make sure that you have good access to should you need it in the future. Don't forget about specialty benefits, things like vision, dental, and hearing. They're often included in Medicare Advantage plans, and some employers may have dental, vision, and hearing coverage, as well as other specialty benefits to take into consideration. Wellness programs are another one. Things like fitness benefits, maybe even gym memberships might be included in your health plan. So you want to understand what those are, particularly if you're someone who's really focused on prevention and wellness. Anticipate those expenses for next year. Maybe your family situation is going to change. Probably the most common one is the birth of a child. So those are things to take into consideration. And then a new tip that I'm giving this year that I might not have given in the past is consider your virtual care options. We've really learned how telehealth has become very popular over the last few years, particularly for younger people who are using it more and more to access their healthcare coverage. So look into all those benefits. And then last but not least, some of those terms can be really confusing. Things like premiums and deductibles and copays and coinsurance. You want to get educated on what those terms mean.
Well, that's such a thorough list. We definitely appreciate your insight there. We're also hearing about whole person health. Tell me about that and why it's important, especially in this conversation.
You want a plan that's going to work well with a whole person health philosophy. This is understanding that our mind and body are very connected, that the decisions and choices that we make as individuals, that the community and environment where we live, that our social supports and social determinants, that all of these things impact the healthcare overall, our healthcare as individuals overall. So the other thing that I'll say about whole person health is very important to have somebody help you navigate that. I really recommend that everyone have identified a primary care physician, someone that is going to help be the quarterback of your overall healthcare and support whole person health, whether it's in person or virtual.
And where can we get more information about this open enrollment period and also find out more and do our own research about everything you've mentioned today?
We have all of this information available. You don't have to remember it all. It's on our website. It's uhcopenenrollment.com.
Well, thank you so much, Dr. Rhonda L. Randall, for joining us today. Appreciate your insight into this open enrollment period. We're going to take a quick break and get back with much more here on Mountain Connections right after this.